Hello, welcome to another one of our Dr. Foot videos. Just in between patients, really busy day. I thought I would make a video. Can you hear that noise outside? We have a very famous pub right opposite the clinic called the Old Crown. Been here since 1368. Very famous landmark in Birmingham. A lot of people come to it. We get Japanese tourists coming to Birmingham just to come to this pub. So they're just making a little bit of noise outside. But let me come back to the video that I was going to quickly make in between patients. I'm going to talk a little bit about a Morton's neuroma. I've had a patient that's asked me about this, and something that I've been meaning to do for a long time. Now, what is a neuroma? A neuroma is when a nerve gets swollen or irritated. A Morton's neuroma refers to specifically the nerve in between the third and fourth metatarsals. You can get pain there, it can be burning, sensation, electric shock, tingling, pins and needle. It's a pain to get better, and it's not easy to live with. It commonly occurs between the third and fourth metatarsals. However, it can occur between any of the metatarsals. Reason why it occurs between the third and fourth metatarsals is one, the nerve's thickened already there, and two, is the way you walk. The first and second metatarsals tend to be quite supports, quite rigid as you're walking. The fourth and fifth tend to be moving around a lot more, so that aggravates the nerve. There's quite a few different things that can happen that can cause pain in the ball of the foot, and I'm going to talk about a few of them before I talk about a Morton's neuroma. First of all, as I have repeated many times, as I'm pretty sure you must be all sick of hearing, diagnosis is key. You really need to know what the diagnosis is. There's a lot of different things that can occur in the ball of the foot, such as stress fractures. Runners can get stress fractures. Ladies with, I tend to say ladies, but mainly ladies who have osteoporosis can get stress fractures. There are bursas in between the metatarsals, which are like small fluid sacs. They can get inflamed. We've got muscles and ligaments that can also get damaged. Now, I made a video about plantar fasciitis. Now, the plantar fascia runs under the sole of the foot. That connects into a plantar plate, which connects the metatarsals to the actual toes. That plantar plate can get damaged. There's an awesome podiatrist called Nick Knight. He's made loads of videos on this. Just YouTube him. You'll find quite a lot of stuff on it. The head of the metatarsals also have a capsule that can also get inflamed. As I said, there are other causes such as rheumatoid arthritis, gout, other types of inflammatory arthritis can lead to pain in the ball of the foot. Sometimes patients walk in and they think they've got a neuroma, and when I palpate it and when I do a couple of different clinical tests, it's not a Morton's neuroma. How do we diagnose a Morton's neuroma? Well, we can send you off for an MRI. Sometimes picks it up, sometimes it doesn't pick it up. We can normally do it just from our clinical test that we do. The Morton's neuroma normally sits further up in that interdigital space, and the way we palpate it, and we do a test called, put this foot down, a Mulder's click, where we hold the foot and we squeeze on that area, and sometimes you can actually hear it pop, the actual nerve itself. I've seen a couple of patients this week who I suspect who have a Morton's neuroma. One and a third one who she thought she had a Morton's neuroma, and I think she's got something else. So the first one who I saw was a lady who had bunion surgery. Now, bunions are when your large toe moves towards your lesser toes. The surgeon was a little aggressive, to say the least. So she's not putting any weight on her first and second toes now. She's putting it all on the fourth and fifth metatarsals. That nerve's getting impinged. So we're going to make her some insoles to try and spread the load across the metatarsals and spread the love. So that should alleviate symptoms. If that doesn't get better, then we may inject it with a steroid, which I'll talk about in a minute. The other gentleman, he's an avid runner, loves running, 10Ks, half marathons, has ran one marathon. He read an article about he can become a faster runner if he becomes a 4-foot runner. I can't even begin to tell you why that is such a bad idea. You can get so many other injuries from changing your running style, especially going from being a relatively, I say normal, but what's normal? from being a runner that strikes on the heel first to the forefoot first, and changing that to somebody that strikes on their forefoot first, you can cause Achilles problems, calf problems. Now, he never caused Achilles and calf problems, he caused a neuroma. I actually suspected him to have a stress fracture, so I sent him off for an MRI, came back as negative, and the nerve was and the actual nerve was inflamed, but so was the joint capsule. So there's a few things going on there. So we're going to give him some orthotics to offload him, and then we may consider a different intervention. Finally, another patient that came in who was convinced she had a Morton's neuroma, but when I palpated the interdigital space, the in between, which is in between the metatarsals, where it normally sits, the pain wasn't there. The pain was right on top of the head of the metatarsal, the third metatarsal, which is the third bone here. I suspect she had capsulitis, and I treat that differently. So let's talk about a little bit of the treatments and why they can work for some people and not work for other people. Often, as I've said many times in my videos, I'm always looking at the underlying cause. Is it because of the biomechanics of the foot? Is it because the patient's wearing really tight shoes that is causing the toes to get squeezed and that nerve to get squeezed, or they're wearing high heels, or is it something? Or have they started a new job where they're on their feet for long periods of time and they were doing a job that didn't involve that? Is there something else going on further at the hips or the knees that is causing them to put too much weight on that structure? So we need to address all of that. I think it responds well to insoles and orthotics. So I normally give a metatarsal raise to raise the metatarsal up and to build in a pad into the insole. And if you take the weight off the neuroma, the nerve, it will heal. It just needs a bit of time and patience. Sometimes that doesn't work and we have to inject. So I tend to do a steroid injection. I'll come in from the top. It's not that painful, but it's not the most pleasant of experiences either. And then if that doesn't do its job, we can send the patient off to have surgery. Surgery has improved a lot, and we can remove that swollen nerve. There's an awesome podiatrist up in Scotland, Dave Cashley, is it? I think he's doing a mobilization for a Morton's neuroma. He's doing his PhD on it. So what he's doing is he's alleviating pressure off the nerve itself just by mobilizing the joints around the nerve. I've tried it. Works really good. It's not really a long-term solution, but it does tend to work really well for about 6 to 12 hours, and then it comes back again. I always give footwear advice. Try and find footwear that's gonna not put too much stress on the actual Morton's neuroma itself. As I've said, as I touched upon, there are many different causes of pain in the ball of the foot. Don't just use Google and think you've got a Morton's neuroma. There are other things that can cause it. I hope you found this video helpful. I better get ready for my next patient rather than just make videos all day long. Take care.